usually hopping in an ambulance, sirens on, get to the airport, take the jet back, land, drive back to the hospital. I mean, all that has to be 4 hours.
Okay, let me explain. This is Dr. Hemmati, who is a cardiothoracic surgeon at Mayo Clinic, and he is about to describe to us the transplantation process for procuring heart transplants, and also a little bit about cardiology, the interventional sides, and the surgical sides. Now back to the clip. I honestly can't imagine performing in front of the family, like where the person have died. And it just seems to be a very intense experience. And especially the function of time, right? Because you do need a proper extraction and I guess procurement, right?
Yeah, exactly. And I think that's why you want to, as a trainee, you don't go alone. Ideally, you go with a staff surgeon who's done this before for many years, and you're on a time crunch for a heart, ideally a 4-hour ischemic time window, meaning from the time the cross clamp goes on and essentially that heart no longer has blood flow to the time it's back at the home institution and getting implanted. That has to include the dissection, removing it, flushing it, preparing it, usually hopping in an ambulance, sirens on, get to the airport, take the jet back, land, drive back to the hospital. I mean, all that has to be 4 hours. And that's why there's geographic restrictions. There's a lot of logistics that go into it, but it's a fascinating part of cardiothoracic surgery specifically, I think. And for people who are interested in transplantation as part of their career, that's a lifelong thing. But yes, it's stressful, and you got to just, as a trainee, learn what you can each time, whether you're doing or assisting with the dissection. You learn, different techniques to become faster, but I should actually say more efficient, because it's never about just pure raw speed. You also have to be technically performing the right thing. So that's a lot of what training is trying to work on becoming more efficient, because I myself and, everybody else when they start out are slow. And then you try to do it the right way. And then the next step is to do it the right way more quickly, i.e. being more efficient. Foremost early on is that fork in the road of, medicine versus surgery. And the lines do blur, because I would say an interventional cardiologist, for example, probably falls closer to the surgery realm, but you actually start in the medical realm. So there are nuances. I mean, interventional radiologists, interventional cardiologists, EP physicians, electrophysiologists. I mean, those are GI. Those are proceduralist specialties that start out with a medical residency like I am, or, something like that. But I think overall, as a medical student, it's important to just figure out, medicine versus surgery. I was team surgery 100%. And then it goes to show that, you might be happy doing a few different types of things, and you just got to find the right people. And I think after you decide on medicine versus surgery, the number one factor for most people, definitely for me, are the mentors that you meet along the way. Because I assure you, had I maybe met some different people along my path, I may be in a different specialty now, but I met some cardiologists and cardiac surgeons who made a huge impact on me. And, here I am now, 6th year of clinical training, 7th year of, residency training in cardiac. And I might have ended up as an ortho or a plastic surgeon or a neurosurgeon or something like that, had I met different people. So it's huge who you meet and who you kind of emulate and who makes an impact on your story.
If you enjoyed this short segment, please like the video and comment any feedback. Also, feel free to check out the full podcast episode where we try to ask the right questions to deconstruct study strategies, useful habits, constructive failures, and life lessons. The podcast can be streamed on all platforms.